My name is Jalen Green. I'm the president of MAPS, and I am a senior at Oklahoma State. One of the biggest things was my grandpa. Before he died from cancer, he really established, being able to help people when you can is one of the biggest blessings in life, because a lot of people, they just need help. And being able to provide that and not ask for anything in return is one of the biggest things I want to be able to do. And be able to provide health education, which especially in Oklahoma is very lacking. And being able to do that for minority students, especially, which is a huge population in Oklahoma that just isn't cared for the same medically as other populations. So one of the biggest challenges for me was growing up in Oklahoma as one of the few African-American students within my community. In my elementary school, there were only 2 of us in a class of about 100 people. It was really eye-opening to see a lot of the discrepancies and stuff that can happen in my communities. Especially going into college, it was very hard because a lot of my advisors didn't advise me to go to college. They really advised me to just graduate high school and nothing else. So having to find an advisor that would actually provide me with a plan to get through college was a huge task. And then also going to Oklahoma State, it was really hard to find a minority association that actually valued the stuff that I was looking for in organizations. And so coming into college, a big thing I wanted to establish was a safe haven for a lot of minority students, or even people that are just first generation, which is a minority. Just to be able to have a solid support system that they could utilize in these rural communities. During college, one of the biggest tasks I had was completing my undergraduate courses. That provided a lot of skill related to my ability to manage time and stuff like that. So the biggest hurdles, I would say, was my courses, as well as studying for my MCAT to get into medical school, while also starting a part-time position at a completely new job. All of those tasks really allowed me to manage my time better going into medical school. So those opportunities really brought me a lot of joy. One of the biggest things is my family's from here. I've been in all the environments. One of my schools was more urban in a city environment. Newcastle, where I currently live, is very rural, and there's no physicians for miles and anything like that. So being able to see these different aspects of Oklahoma has brought a lot of just a lot of knowledge about stuff I wasn't aware of, especially as I get older. Being able to be spatially aware of what resources people can access in different areas has really allowed me to know that I want to stay in Oklahoma. And I really want to help improve a lot of the access we have to healthcare and stuff here. If I was going to offer a piece of advice to an underclassman or someone that was just starting their medical journey, I would really want them to try to seek out resources available to them, whether it's through campus, whether it's through a lot of nonprofit programs, and then there's a lot of stuff through the state of Oklahoma as well, and OU and OSU programs that can just get you involved. There's so many shadowing opportunities, there's so many just available opportunities for education, and I think being able to access those resources is going to be huge. So improving that access, improving the education is at the forefront here.